and welcome back to White Mouse Today. As you can see, we have a full couch here. We have Gary Tilley and Deb Moffett. Deb, you work here at the station. Gary,
yes, I do.
Over at 1-to-1 Fit / Lakeside. Is it Lakeside Rehabilitation?
Lakeside Physical Therapy.
Physical Therapy. Well, welcome to you both. Glad to have you. Looking forward to this interview for a couple days since I heard that you were coming. Yeah. Full disclosure, Deb, of course, I already mentioned, works here at the station. You've been doing PT with Gary.
Yes.
And I've also been doing PT with Gary. So we have a lot of experience here. Gary, why don't you tell me your background first? How did you get into this whole physical therapy? You're a physical therapy assistant.
That's correct. Graduated from Claremont Tech back in '86, long time ago. Got into a head injury playing baseball. Really? That's how it started. Huh. Needed my own rehab. Wanted to be going to nursing. Yeah. But no, I'm a sports guy, so perfect fit.
Yeah, I think that's why I have such a great session, because we always just talk sports the whole time. Yeah. Working out hard, you know your stuff. That's the first question you always ask me is, what's going on today? And I'm like, here. Yeah. But what I really appreciated was the whole process, how easy it was. With me, it started with an injury. You were already working out, which, kudos to you, but for me, it was my lower back. It just went. And so you guys got me in, did a little evaluation, and then you got me started on a program, and 3 weeks later I was skating again. It was pretty cool. Yep. So Deb, why don't you tell me about your experience?
I was about 7 years overdue for a knee replacement.
7 years, way to jump on it there.
Right, yeah, well, you know what, that's not unusual, and I think a lot of people delay having replacement surgery because they're afraid of it. I was afraid of it, and I was experienced with it. But you worry about your time off from work, you worry about the pain, you just worry about everything. And I did preconditioning. The doctor said, if you get in shape for this, you will recover more quickly. So I did preconditioning with Michelle at 1-to-1 Fit. So that my muscles were strong and
so
my body was
before you went to surgery,
ready.
You were with Michelle?
Right. Then after surgery, I started working out with Gary. And I have to say, I was back, gosh, it's been 7 months now, and I feel, I'm actually ready to go skiing again, and I haven't skied in 6-7 years.
Excellent.
And I actually did play tennis this summer, about 3 or 4 months after the surgery, and hadn't played again in 6 or 7 years.
Wow, that's so cool.
Now, it was amazing. The experience was just, it was great.
Now, Gary, I almost introduced you as Gary Magic Hands Tilley, but I thought I'd hold back a little bit, because you guys really do. It's an integration of, you mentioned the so if you know you have to have an operation or something of that effect, you can get in there and start strengthening. But it's also, it's a continuation. Like, people get inspired. They have this injury. They're like, I don't want to ever do this again. So do you find that a lot of people continue right into 1-to-1?
Absolutely. Being in the Valley for 20 some odd years, I see what 10 years does to people. And so conditioning, 1-to-1's a perfect fit, no pun intended. Okay? Because we're there, we can supervise. It's often that I'm telling people, look, you're doing it wrong.
Right.
You got to smarten up, or you're going to get hurt again.
Well, that's the thing. I think people get stale, and they're always coming out with the latest advancements. I think that's where 1-to-1 Fit and Lakeside, you guys are up to date on this. It's not, you don't want to really stretch out hard, cold muscles and all this stuff. And you guys come in and you've retaught me how to be healthier, and it really helps just make everything more efficient. I can do my physical therapy. I'm looking forward to my 1-to-1 membership. And they offer not only this physical therapy right in the gym area, but they also have yoga and hula hooping and all this really cool stuff. So it really is, and it's all clean. It's so clean. I love it there.
Yes, it is.
Yeah.
Nutrition is a huge component too. We can't stop talking about that, because that's a common, what's diets? What's, give me recipes. Well, that seems to be the main focus. Food.
I know, and usually my session's right before lunch, so by the time lunch comes around, I'm heading on over and getting like a funky monkey.
And every physical trainer I've worked with there has always asked me about my diet and told me to lay off the wine and
you gotta have.
But I actually have improved my diet with one exception.
Oh yeah, good. So you're on the mend now, Gary. What would be probably your biggest advice to people out there, that are?
Geez, try to stay motivated.
Yeah.
Don't get into ruts. getting stale.
Switch up, and sometimes coming in to a place like One-to-One Fit can do that. Yeah.
You know, working with a different trainer.
Right.
You know, like Jane and I, the therapist that I work with, she is just so cool.
You guys are very different.
Very different.
And I love it.
And people get a dose of her, and then they get a dose of me. And it's a good mix.
Well, it is, because, and again, like she does the massage and she'll use her elbow.
Yeah, she's tiny.
Yeah, she's tiny, but it's amazing. She gets in there, and you give a whole different kind of massage, you know. So I think it all works out very well. I'm super happy, and you know, and it was nice for me because my insurance, it was easy for me. I went to my principal primary care provider. He gave me the script. I went over, and within that week, I was in with you.
Kelly, you just brought up a good point. Healthcare today, you know, we're given 6, maybe 12 visits.
Yeah.
That's it. And that is it. And so we're able to migrate these people for a free 30 days.
Yeah.
And that has been a big catch.
It is.
For people.
It is.
Big
and
catch.
I think they see the light, though.
Yep,
you know,
they
it can
do.
be just long enough to develop that habit
Yep.
that you're like, boy, I feel so much better now. So it's a good start. And now, how did they get in touch with you?
Geez, they need their referrals from their primary cares, local orthopedics, traveling physicians. People go to Portland, Massachusetts still. They need a physician's prescription. They get their evaluation by Jane, my coworker, and then they're migrated into the schedule.
Wonderful.
Yeah,
and it's been a great schedule, especially you guys are very accommodating.
We're very flexible.
Yep.
I can start as early as 6 o'clock in the morning if I need to.
You're going to have to start hosting then, because I'm not good at
6 o'clock's a little early for people, but I've been doing it a long time, and people like that kind of schedule.
Yes, they get it done.
And I work until it's done.
Well, good. Well, Gary, thanks so much for joining us.
Absolutely.
Hopefully it wasn't too painful for you.
No, it was pretty cool.
All right, and Deb, thanks so much for getting up too.
Oh, my pleasure.
Yeah, it starts the weekend early, right? Now, we have a special treat though, because we sort of doing the dual side of One-to-One and Lakeside. We're going to move the physical therapy part out a little bit, and we're going to have Michelle Rober come in and talk about more of the One-to-One Fit side of things. So thank you so much, both of you, for coming this morning, and we'll be back with Michelle Rober.